Are you ready to decolonize your healthcare approach? Go ahead and watch this video for practical tips. So how do you decolonize your healthcare approach? Let's look at step by step. My name is Dr. Steele. I'm a board certified naturopathic doctor. I hold 6 degrees in my field, all in the natural healthcare space. I went to school, so you don't have to. All this month, we talk about the colonization of healthcare. I have a webinar down below. It's an instant free access. All you have to do is just click the link below and it'll take you there and you can watch it, and it goes over all the history, facts, and a solution. So, all right, so today we're going to discuss the practical steps that you can take to decolonize your healthcare approach. So let's talk about how we can make it more inclusive, but also culturally sensitive, because that's really what it's about. First thing to do is to educate yourself, and not educate yourself in terms of what other people are doing, but more so educate yourself from your cultural perspective. So understanding your medical traditions and acknowledge your biases that you may have. And that can be a little challenging, especially if, you don't have a counterpart, somebody that believes somebody different. So I would definitely recommend that you read books, attend webinars, or even take courses that cover different medical traditions and practices and histories than what you are used to and what you are concerned about. If you get triggered, it's okay, breathe through, and then emotionally process. The other step I would say is to integrate other diverse health practices into your daily routine. So whether that are things like herbal supplements or teas or yoga or trying a naturopath or acupuncture, exploring what works best for you. Consulting healthcare providers who specialize in holistic health can help you to get a personalized drive. We do everything science-driven, everything data-driven, and everything personalized to you, and that can really help you to feel more inclusive and really just more seen in your healthcare experience. So the third step I would say is advocacy. Advocacy is absolutely the key. We really want to work with local healthcare systems to be more inclusive. So this is even just communicating and voicing your concerns and taking a stand in your healthcare space if you don't feel included. But it can also be things like participating in community events or joining TikTok groups or those kinds of things to be able to really get some different ideas and get some different perspectives. So again, I would say if you are looking to decolonize your healthcare, number one, you want to educate yourself, learning about different medical systems from all over the world, studying both Western as well as traditional practices, understanding the principles as well as some of the benefits of some of these practices, because they've been around for centuries, and sometimes, most of the time, even a lot longer than our Western practices. Also explore the historical impact. So I'm definitely trying to get up to speed with that because I know the scientific side, but definitely understand the historical context can also help you to understand motive and intention and why the system is set up the way that it is today. Definitely, I'm a proponent of obviously embracing holistic healthcare that incorporates all kinds of natural remedies, using those remedies, using different practices, that are really tried and true to you and your culture, I think is incredibly important. Lifestyle changes, naturally, food, nutrition, stress management, they are all individually tailored and personalized to you based off of your genes. So if you have your genetics, that makes it really easy to help us to determine what things are going to be effective for you, because again, it's DNA, it's data. Also too, you want to seek inclusive healthcare providers. So that's not just people that look like you and me, but it's also people who are doing the work, who are actively learning, seeking, and really deconstructing their own work. You want, just like with a therapist, you don't really want to see a therapist who doesn't see a therapist themselves, because they're not really practicing what they're preaching. Wanting to making sure that the person that you're seeing is not just looks like you, but also thinks like you, feels like you, and obviously their values are going to align with yours. I would also say, as in any healthcare setting, you absolutely have to advocate yourself if your doctor is choosing not to listen to you, or they're getting reactive when you ask questions, or they're using certain institutions such as, Child Protective Services or other institutions, hospital administration, to weaponize against you. This is definitely a good opportunity for you to report that doctor. There are, certain entities, the Board of Medicine, etc., are entities that are technically designed to, obviously protect you. Naturally, is some challenge with that. So making sure that you document everything, names, telephone numbers, also insist to record your appointments. I know that there are a lot of practitioners that don't like that, but that is your right as a provider. Also, too, I would say really seeking out your traditional practices. So talking to your elders, talking to healers in your community. I know sometimes that can be really difficult, but seeking knowledge from people that are beyond just yourself and your community can really help, but also within your family system. I think that's really important. And then you want to create a personal health philosophy, defining your health goals, what you're looking to learn, what you're wanting to accomplish, setting your goals from a physical, mental, emotional, spiritual, even environmental health. For me, I needed to leave the States. That was part of my environmental health, personalized health plan, and so looking at what those things can be. You also want to regularly review and adjust your plan. Like any treatment plan, you definitely want to look at it. Looking for supportive community health initiatives and community groups can really help you in your journey. Finding different groups, I know definitely online, there are a lot of them if you're living in a more remote or rural place, but also too, there's a lot of local places too. But ask questions, really be critical in your thinking. Don't just accept it just because it looks good on the surface. Really start to question, listen to yourself, listen to your intuition, because that's really gonna help in this process. So there is a lot that I went over in this video, and hopefully some things that you take away. Some other things that I want to mention that we'll go over as well is using technology. So technology has come a long way. It can really bring a lot of the remote patient tracking. We do a lot of this in our practice already, where we actually monitor and track patient data through remote patient data tracking, and we teach our patients what the data means, so the patient doesn't have to wait and go to this place or that place. And they also don't need to be dismissed or undermined, because it's a number, it's an objective number, so it's either high or low. And so our job as providers is to figure out why that number is high or low, and then be able to teach our patient. And as you're walking through this journey, I cannot stress enough, building that supportive network of people to help you, to be with you, in your journey, in your unpacking, in your healing. We all need support in our health journey to exchange information, health tips, as well as advice. And so I know that we've went over a lot, but it's really about questioning everything in your healthcare practice. I think we don't question enough in our healthcare. We go blindly, and then when we go blindly and we get burnt or we get hurt or we get injured, then it creates a secondary trauma. So one, we're upset with obviously the provider, but we're more upset with ourselves because we knew along the way that there was some issue going on that we didn't quite believe, but we didn't trust ourselves, and therefore it creates even more of an impactful traumatic experience. So iatrogenics is medical trauma. It does exist. I do work with it often in my practice. We didn't touch on it in the webinar, but we will have additional webinars in the future that really expands upon this topic. This is really just the first of its kind, really getting that information out to get you to think critically about your healthcare once and for all. My name is Dr. Steele. Thank you so much for checking out my channel, and like, share, subscribe for more.